How's everybody doing today? I want to thank everybody for coming on and joining us for this Hoof Abscess webinar. My name is Corbin Delaney. I am the marketing manager here at Life Data Labs. And today I'm with Mike Barker and Darren Owen. They're going to be your presenters today as they share their knowledge on the hoof abscesses and on how to deal with them. And again, today we will have a giveaway during the webinar. So please be ready for that, and good luck to everybody who's looking forward to the giveaway. And also, as we go through this presentation, I know that several of you will have questions. We will be answering questions at the end of the webinar. If you look at the right-hand side of your computer, there's usually a GoToWebinar menu. You can open that up and submit your questions at any time during the presentation. But we will not answer those questions until the end of the webinar. So please just stay with us, and we will handle all those questions when they come. Okay, so I'm going to go ahead and hand it over to Mike and let him begin the presentation.
Thank you, Corbin, and thank you for taking the time to be with us today during this webinar. We hope that you will find it informative, educational, and as Corbin stated earlier, if you have any questions, well, please submit those toward the end as well. And also, if there's any topics that you would like to take for us to take a look at as far as future webinars, we would certainly love to hear back from you, so please share that with us as well. We do have a guest speaker with us today, Mr. Darren Owens from Scottsville, Virginia, and we certainly thank Darren for taking the time to share his knowledge and his expertise during this particular webinar. And we're going to be talking about hoof abscesses today, and our question is, number one, exactly what is a hoof abscess? And hoof abscesses are pretty common. As I work trade shows and talk to horse owners across the U.S., that's a pretty common conversation. My horse has an abscess, or I have a horse that has chronic abscessing. I can't get it to stop or whatever. So let's take a look at that. And the first thing that we need to understand is exactly what an abscess is. Well, actually, it's a bacterial infection, number one. And that bacterial infection is going to be located in the laminae. And the laminae is the attachment mechanism that actually holds the hoof capsule to the coffin bone itself. And as this infection grows in that particular laminae, then we have tremendous pressure that's being exerted, especially on the nerves that are going to be located there. And of course, this is going to cause pain within the hoof capsule itself. And if you have never dealt with an abscess in the past, this can come on rather quickly. In fact, you might visit your horses this afternoon, and in the morning when you go back, you're going to have a horse that's actually dead lame. And if you've never experienced this, and you're going to say, well, ooh, that horse has a broke leg, something is bad wrong, something is going on with that horse. So it's a very painful situation for that horse to go through as well. Now, a lot of times, our entry point for this bacteria is going to involve the white line area here. And that white line area may be compromised, it may be weakened. We may also have thin hoof walls. It has cracks, chips in it. We may have old nail holes, which are entry points for bacteria. So what happens is that we have this bacteria that enters the sensitive area, and then we have an infection that starts at that point there. And on our next slide, Darren is going to talk about the different types of abscesses.
Yes, thank you very much, Mr. Barker, and thank all of you that are with us today for this webinar about hoof abscesses, which is something that I'm sure at some point along you will experience. Your horse will have to go through this. One of the things that we talk about that, and it is in fact one of the causes There are a few, but it is one of the causes that you will experience or take and see your horse that will actually look and be described as being three-legged lame. The horse will not walk at all on that particular affected limb. And when you see the horse, it's a very acute onset. And when you see your horse in that position, you will think something serious is wrong with your horse. And in fact, it is. So it has developed an abscess, either a solar or hoof wall abscess, and that essentially that abscess is comprised of liquid. The liquid is not something that can be compressed. So when we think about the actual area that is the abscess, we can kind of think of a small water-filled balloon. And no matter where you push that balloon would displace into different areas. However, it is underneath the sensitive region of the horse or corium of the horse, and the horse cannot compress or get rid of that pressure that is developed in there. And that's why you'll see that acute onset in which the horse will be described as being, in fact, three-legged lame. They will be in two regions of the foot. One, as we talked about, you see on your slide on the left side, in the solar region of the foot. And that's going to be between the solar corium and the what we would describe as the insensitive sole. That we'll see on the ground bearing surface. Both of these are truly infections of the foot or hoof. And then on the other side, where you see the hoof wall, that in fact is the infection has decided to move up in along the lamina. Some of the regions that we talk about when we talk about hoof abscesses, they're normally going to be limited to the sensitive lamina, the solar region, and the coriums that are associated with those structures. However, one not to forget is that great big one you see in the middle of your left slide, and that in fact is the sole, the frog. It's right there in the middle of the sole. And the frog also has a corium and also can be subjected to infection as well. When we think about our wall abscesses, they're commonly referred to as gravels. And sometimes they'll have small pieces of foreign objects or some sort of entry point that'll go in there and work its way up the hoof wall. And then in your right slide, you see where it popped out right at the coronary band. A lot of our equestrian facilities now have stone dust. If you're familiar with stone dust, that is a very, very fine, small stone type mixture. And sometimes can penetrate and get underneath the shoes and then the barefooted horses. So those are some of the things that we would think about between the two different types of abscesses we'll speak about today.
Thank you, Darren. Now, let's take a look at what causes that particular abscess itself. And one of the first things at the very top of our list is going to be wet, dry conditions, the environment. The environment plays a tremendous role as far as the quality of the foot itself. Of course, we know that excessive wet conditions will help soften the foot. A lot of times we'll end up with a little stretching in the white line area. And then when we go to those dry conditions, the foot wants to do the opposite. It wants to crack. It wants to contract. At that point, it'll want to crack and chip as well. And these areas that have been compromised, whether it's wet or dry, become entry points for this bacteria to get into the foot itself. Of course, we can also have bruising that comes about from the terrain. We can step on a rock, we can be on a hard surface, whatever that causes a bruise, and that bruise can actually lead to a future abscess. Another easy means of starting an abscess is just a penetrating wound. Something penetrates the sole of the foot, that becomes an automatic entry point for that bacteria to set up shop and to create that abscess as well. Poor management as far as where the horse has to live, whether those are wet conditions, the stall itself, how good we do as far as managing the cleanliness of the stalls, keeping them clean and dry is a factor. Our farrier has a tremendous influence as well as far as keeping that foot balanced. in the right form and fashion. And then the last one on our list is simply poor hoof quality. If we have thin soles, if we have thin hoof walls, then we're going to more than likely end up with an abscess at some point in time. And as we take a look at the next slide here, I'm going to let Darren take each one of these, and he's going to take these and give you a little more insight to that. And so, Darren, I'll let you take the first one here, these wet, dry environmental conditions.
Yes, sir, Mr. Parker. Thank you very much. And that's a great illustration of these points of discussion that we speak about when we speak of hoof abscesses, and what essentially their points of origin can be vast, and how do they affect our horses in their working environment as well as just their everyday life. And one of the ones one of the first one that you pointed out, the point of discussion, is in fact the wet, dry environment conditions. And in my experience, this has been a kind of seems to be a larger percent of the causes that I see. It seems to be when you go through the process, looking at the points of origin and how we can help these horses going forward, and to potentially eliminate them from having to experience these bouts of excruciating pain, and then essentially being out of service for a certain period of time. We get down to the wet dry conversation, where the horse essentially loses its ability to protect his or herself from the outside invasion, whatever that may be. And there's several on this list that we talked about. And as you can see listed on your slide, the attendees can see, the bullet points when we talk about what these wet dry environments cause. And these are going to be quite often these abscessed areas that when we see a frequency of these, we'll see them sometimes in regions of the country that will, say, for example, experience coastal storms, tropical depressions, hurricanes, large amounts of rainfall, early springtime rains. Some of the regions refer to them as mud seasons. They'll get into, and these horses are exposed to this excessive wet, and then it turns back a little bit dry. And normally we're going to somewhere between the 7 and 14 day mark, these horses begin to start to have trouble. So this is a big part of this conversation that we're having today, that the horse essentially loses its ability to protect itself, and the foot essentially becomes weakened.
And as we take a look at the next cause of an abscess that deals with bruising.
Yes, sir. When we look at that and we talk about the terrain and bruising, this is the photograph is a nice illustration of a horse working on the tarmac. Essentially, as you can see, the wheel there pulling a carriage, and this horse would unfortunately be susceptible to stones, harder objects as they move along on the tarmac doing their work. But this also can be taken back into your saddle horses as well, or even horses at leisure. So this is a great example of how you can pick up a rock or obtain a bruise, and once that rock hits that sole and starts that process up underneath from the external trauma, you'll begin to see that as well as a point of origin. And then the next one you have illustrated there is your penetrating wounds. Now, before we even talk about penetrating wounds, let's just make sure everyone that's on this webinar understands that this is an absolute emergency, an absolute veterinarian farrier emergency. There's not any conversation to be had other than the fact this illustration, as you see in that radiograph, is a true emergency. And the reason being that is because we don't know as farriers or hoof care practitioners where or that particular penetrating wound has gone, or that object has caused, what kind of damage and or structures it's passed through, and the horse, these structures that are inside these horses' feet are highly sensitive. And so with that being said, that we need a radiograph and we need veterinarian assistance to be able to see the location of the object, the direction in which it entered the foot, how shallow, how deep, and what structures are involved. So that absolutely has to involve a joint hoof care project between the veterinarian and the farrier before that's taken out. So when we think about that, horses are susceptible to them. They can pick them up, whether they be, that as you see there, that's a nail, glass, scrap metal, wire, all different things are out there for the horses to walk across. And then when we look in our bullet points, we see the thing accidental injury. And we have to raise our hand as professional farriers and understand that the accidental injury is essentially a nail prick. We are driving nails in these horses' feet, and we hope it never ever happens. But if you drive enough nails as a professional farrier, you're going to prick a horse. And essentially that is a penetrating wound and a foreign object at that point that is in the wrong place. So we also have to think about those and the abscessing problems they can cause as well, as they may introduce bacteria into the horse's feet. They truly are of a very high priority and need to be treated immediately as well. So that's our caption on the penetrating wound, and you can see from the radiograph on your left what that object truly was in sense of a large roofing nail there in the bottom of that particular horse's foot. Now management, as we go into management, that as well is a huge conversation for us, because this is thought of as something, this is something that causes this horse kind of a slower deterioration, in the sense of, this horse is exposed to this every single day. It may not be exposed to stones or some sort of a penetrating wound on a daily basis. However, when you look at the poor management list, when we think about our stalls not being taken care of properly, the husbandry not being up to par, and what's contained in the urine and essentially the manure of the horse that essentially would be in the stalls, these particular things just slowly deteriorate the horse's ability to withstand itself from invasion. So these are some conversations that need to be talked about and looked into as well, if you're having a horse that has some potential abscessing that can be a cause. And then the last one of the last ones that we're looking at, we're talking about unbalanced hooves. That would be the second to the last bullet point that you saw earlier in your slide presentation. And the unbalanced hooves are something that what they do is similar to the slide we just looked at. They're a point of origin, and the reason they are is because the actual hoof is being exposed to stresses in which it's unable to withstand. So what I mean by that is, if, for example, the hoof, barefoot or shod, it's not going to make any difference, that the one side is higher than the other, whether the front of the hoof, the back of the hoof, the inside or the outside, the horse will have extra stress or strain on that portion of the foot and cause that wall to separate. Well, if it causes the wall to separate, as we talked about, we now have allowed that area to open up and predispose the horse to bacterial and or fungal infections as well. In that particular area, we cause excessive strain and deformation to the foot. So having balanced hooves and regular farrier care is very important to help ward off abscesses in your horse's feet as well. And the last one we go into is poor hoof quality. And when we think about the poor hoof quality, again, we're kind of going right back down to that ability to ward off the invasion, because the horse is dealing with examples would be your thin-soled horses that would be prone to bruising because they don't have nearly the protection on the bottom of their feet that they would need to be working horses and to do their work and to defer the environment, such as the stones you see there in your photograph. The walls, you can see that wall is cracked and broken away, and it just makes them so much less resilient to infections and bacteria being able to enter in to the hoof capsule itself. So poor hoof quality is definitely on the list of making sure the hoof is successful in its work.
And as we continue to move on, let's consider a few signs of a hoof abscess. Of course, some of these we've already mentioned earlier in the presentation. Of course, we realize that we're going to have sudden lameness by all means because of the severe pain that the horse is going through at this point in time. And if we do a little further examination, if we actually pick up the foot of the horse and actually feel the hoof capsule itself, a lot of times we can feel a little warmth, a little heat that's being created by the infection that's going on in the capsule. If we will check the digital pulse, a lot of times we will find it to be bounding as well. And if we do a further examination, say of the sole of the foot, if we clean, pick, brush off, we might even find an entry point or an injury that has taken place that we're not aware of. We might actually find the drain tracks either in the sole of the foot or the coronary band itself. And we might even actually see this blackish, grayish pus drainage actually coming out at this point in time. Some tips that we want to take a look at and consider. Of course, we want to act quickly. We want to jump right on top of the situation. Certainly we are wanting to consult with our vet farrier for their diagnosis, to fully understand and to determine exactly what's going on in this lame horse at this point in time. We need to keep in mind that an abscess actually can mimic some other problems that can be going on, such as laminitis. We might actually have a coffin bone fracture or a solar bruise itself, and it gives us some of the same clinical signs as this particular abscess. And when we get the vet, the farrier involved there, they're probably going to use some hoof testers. And with the hoof testers, they're going to be able to kind of locate, find, determine exactly where this abscess is at. And as we go to our next section of the webinar, we need to take a look at how do we treat a hoof abscess when we get to that point there. And as we just mentioned, it's going to involve the vet, it's going to involve the farrier. And one of the things that they're going to do is, number one, is they're going to locate that abscess itself if they can. And to get immediate relief from the pain that this horse is enduring, they're going to want to open up. They're going to want to drain this abscess. And once that is accomplished, then there's great relief from the pain at that point in time. And a lot of times an abscess is going to rupture on its own if we don't jump right on the situation. And if we can actually get that abscess to rupture out of the sole of the foot, that's going to be a better situation than that abscess tracking up the hoof wall and actually exiting out at the coronary band itself. And a lot of times in this treatment process, to help speed up the rupture part of the abscess, if we can't find it or locate it, a lot of times the horse owner is going to have to do some soaking as far as warm water, Epsom salt. There are many other things that can be used to help aid in the rupture of the abscess itself. Animal Lintex is another product that can be used. Ictamol is another one as well. And let's get into the recovery part. And a lot of times this can be a pretty quick process. Typically within, I'd say, a matter of a few days, a couple of weeks. Sometimes if this is an abscess that takes place or ruptures at the coronary band, then this can be a much longer and drawn out process for the horse, and that horse is actually basically got to regrow, regenerate an entire new foot to repair, to heal that exit wound itself. The thing that we need to keep in mind is that proper recovery methods are, if they're not followed, then the chances of the horse having an abscess again are going to be pretty great at that point in time. Of course, our goal after we have an abscess is basically to restore good hoof quality. And some of the tips that we offer from Life Data Labs as far as recovery, number one, it's going to involve a team, which is going to be the vet, it's going to involve the farrier, and it's certainly going to involve you, the horse owner. And as a horse owner, we want to follow the recommendations of our veterinarian, the farrier. But when it comes to the horse owner and in their duties, the horse owner is going to see this horse on a daily basis. And they've got to protect the exit wound. They've got to promote new hoof growth and quality. They've got to manage the environment, the cleanliness of the stalls. And then they've got to maintain hoof maintenance on a regular schedule as well. And as we just said, it takes a team, and that's the vet, it's the farrier, and the horse owner. These plans need to be mapped out, they need to be followed, and then it's up to the horse owner to take care of these on a daily basis then. As far as protecting the exit wound itself, there's nothing wrong when we have an open wound like this to actually flush that wound out with peroxide. In fact, we can take a syringe with a soft tip, flush that out, and then a lot of times it may involve keeping that problem area wrapped. And we can use gauze. We can actually soak that gauze in some disinfect. A product that we offer that would be in a liquid form is called Farrier's Finish, and that gauze can be soaked in that. And then we can actually use a little vet wrap, elasticon, a duct tape, and keep the foot bandaged and wrapped up. Of course, we need to keep in mind that we'll need to change this bandage on a daily basis as well. Of course, a lot of horse owners will actually use a diaper as well, which works well as far as protecting the wound itself. Something else that we can do as far as promoting hoof growth and hoof quality is supplementation. And what supplementation is going to do, especially if we add a hoof supplement to the diet of the horse, it's going to provide that horse with needed nutrients to help regrow the foot, to improve the quality of the foot as far as the hoof wall, the sole of the foot. And then as we do that, that's actually going to strengthen that area between the sole of the foot and the hoof wall itself, that white line area. We want to keep it tight, we want to keep it sound, and we want to eliminate any chips or cracks in the hoof wall itself. And if we can do that and we end up with a good, sound, solid foot, then that foot is going to be more resistant to an invasion of bacteria or fungi that's going to start that abscess. Darren, I'll let you take a look at the environment if you don't mind.
No, sir, I don't. The three points that you just covered ahead of us, one and two of them, one was the protection of the exit wound, and the other one following your veterinarian and farrier instructions. They certainly, this is going to be part of how to keep those particular points of discussion successful. And when I say that, quite often the abscess, the plan may be in fact to apply some treatment material inside, and then you're going to wrap it with an elasticon. However, that's going to have to be changed, and that's going to need to stay in a dry, clean environment. In one that may have been a bit more serious in the sense of a puncture from a foreign object, it was a bit more serious in the horse's foot. The election may in fact be a hospital plate. Well, if the horse is shod with a hospital plate, certainly that plate has to be opened. The material, the treatment material has to be put back in and again closed up. And to manage the horse in the conditions, you can either help accelerate that healing or you can slow that down. And so to keep the horse in a clean, dry area is essential. However, following the veterinarian and farrier instructions, in most cases, movement of the horse, allowing the horse to move around, is also going to be a desired part of the treatment plan. So it becomes a bit tricky, and it does require an exceptional level of attentiveness from the horse owners. So we want to make sure that we are working together along with the environment. So if we know we have storms coming in and have heavy rain, we want to pull this horse up out of that dry paddock and things of that nature to ensure that we are being successful with the care of the horse.
And as we go to the next slide, Darren, how important is it to maintain a regular maintenance schedule?
It's critical, and the reason being it's critical is one of the examples that we talked about, we saw earlier, is in fact we called it a gravel. It's an abscess that works into the wall. Some of them, if they can in fact be a little more severe, they can be a solar abscess and a wall abscess. And when they get into that, when you get a gravel, essentially it's going to travel from the ground bearing surface of the foot all the way out to the coronary band. And so you're going to have a vertical tunnel, if you will, where that infection has traveled all the way again from the ground bearing surface to the coronary band. So as this foot begins to grow back down, pretty quickly after that wound has healed at the coronary band, and I reemphasize that is a wound, it needs to be treated as such. As it starts to come down, you'll see a horizontal line in the horse's foot. Well, keep in mind, from that horizontal line to the ground surface is in fact a tunnel, and that area of the foot is very predisposed to cracking and splitting, and which again would open that foot up and cause breakage and or reinfection. So that's one example of why a regular farrier schedule should be kept at any point, but then especially when you're maintaining or trying to look at a horse that's recovering from an abscess or an invasion such as that, and to ensure that you have a watchful professional eye on that foot as it's healing and going through its process. Now that will take somewhere between, essentially can be 7 to 12 months, depending on where the infection was for the whole foot to grow down. If it comes at the coronary band, we're talking 9 to 12 months, and that's when the horse is on double strength Farrier's formula. However, the abscess event, depending on what region of the foot is, we can talk about something that can take 2 weeks to 4 weeks to get itself squared away. We may have pretty quick relief when we're able to locate it, but it does take a while for that tissue to regenerate itself and the horse return to soundness.
So let's take a look at what we can do now to prevent. And if we can actually prevent an abscess, that's going to be a much better situation than to actually have to deal one head on. So actually our goal number one is to prevent that abscess if we all possibly can do that. And if we take a look at the next slide here, there's some things that we can do to help ensure or to cut down on the likelihood of an abscess. Of course, as a horse owner, we want to maintain those hooves on a daily basis. We can incorporate a supplement to the diet of the horse, such as double strength Farrier's formula. We can actually use one of our products, our hoof clay, and fill the old nail holes, which is an actual entry point, a direct entry point for bacteria to get underneath the hoof wall itself. That clay can be used in cracks, chips, or any hoof wall defects, or anything that's going on in the sole of the foot as well. We want to be mindful of where we actually ride the horse, keep the horse outside as far as the terrain itself. We also have a liquid product called Farrier's Finish, which does a couple of things. It helps us control the moisture within the hoof capsule, and it's an antimicrobial, and it's going to help fight off any bacteria or fungi that would be present. And then, of course, the last thing, as Darren has just mentioned, is we want to maintain a regular farrier visit there. And let's talk about just a few minutes about double strength farrier's formula. Of course, farrier's formula has been available for 40+ years now. The farrier's formula was developed through extensive research that Dr. Gravely has done through blood work on horses that have had problem feet. And essentially, the main purpose of farrier's formula, this hoof supplement, is to improve dermal tissue. So over a period of time, it's going to help regenerate, regrow the foot internally. And as it does that, it's going to thicken and strengthen the hoof wall. It's going to thicken the sole of the foot. It's going to improve that sole hoof wall junction there, which is one of the major points of a bacterial invasion. And so if we got a good, sound, solid hoof, then we're less likely to have this invasion of bacteria. The other product that we have mentioned earlier is our hoof clay. It's for specific problem areas within the foot itself. It's an antimicrobial packing. It's a very mild, non-caustic product. It's made up of some tea tree oil, some tame iodine, and some yucca. And as we mentioned, it's great for old nail holes, chips, cracks. It's also a great product for thrush as well. And if you have a thrush problem, basically we can do incorporate a coating of this. And depending on the weather conditions, we'll have enough residual left there after an application for, I'd say, 3 to 4 days, and then we would come back and address the situation as well. And another great area to use this product is if our horse is shod, and that would be underneath the shoe. And if we'll do that, then when the farrier actually nails the shoe on, he's actually driving the nail through the clay itself, which is an antimicrobial, meaning that it's going to fight off any bacteria that might have been on the nail itself or in that new the new path that was created by the new horseshoe nail. Good, safe, sound product. And the last one that I'd like to mention right quick is in a liquid version, our farrier's finish. Tea tree oil, tame iodine, and yucca in it. This product can be used on the entire foot of the horse, the sole, the entire hoof wall. It's going to do a couple of things for us. It's going to help us with our wet, dry conditions. It has the ability to shed moisture when that's the issue, and it has the ability to retain the needed moisture during those dry periods as well. Of course, with the tea tree oil and the tamed iodine, it is an antimicrobial, so it's going to deal with bacteria, fungi. It's a great product for thrush as well. It also has a little yucca added to the product, and the yucca will actually bind up, tie up the ammonia from the urine and the fecal matter. So if we don't do a very good job at maintaining our stalls, if we'll use this product, especially on the sole of the foot, it'll help protect the foot from that aspect as well.
Okay, now it's time for our webinar giveaway. Here in a minute, I'm going to randomly draw one of your names, and that person will win a bag of the Farrier's Formula Double Strength or a pill. You can, when you send in your information, you can put in your preference on whether or not you'd like the bag or the pill. Then, of course, some of the hoof clay, and then some of the finish. And then as I'm drawing it, we're about to get into the question part of the webinar. So if you have a question, feel free to go ahead and submit it. I've seen that we've had several come in already, so we will begin to answer those here in a minute. Okay, so I have randomly drawn the winner, and it is Carolyn Warner. Carolyn Warner, if you will email cservice@lifedatalabs.com. Again, that's cservice@lifedatalabs.com. In the subject line, you can put webinar giveaway winner. And then if you'll just provide us with your shipping information, and we will go from there. So congratulations to you. And if you have any questions or anything, let us know. Okay, so questions. Let's see. Okay, so the first one comes from Darlene Berry. She'd like to know, do hoof liniments really work? And what would be a few of the best products ingredients?
Darren, would you like to answer that question?
Well, I certainly would have
I don't, when she says liniments, that kind of throws me just a little bit there. I think she may be talking about a topical for the foot, maybe.
Well, that's what I was going to say. The liniment verbiage was a little bit, but it's difficult. I just want to make sure in clarity. I'm not speaking of a liniment. I would be speaking of a hoof dressing or a topical that would go onto a horse's foot. And I can say from my experience, I do see success in using hoof dressings or topicals and or packing such as the clay. However, I would caution using anything that would be caustic or could be harmful to dermal tissue. And I think the kind of the easiest way to put that forward is that you wouldn't use anything on your horse's feet that you wouldn't use on your feet. So that seems to be a safe way of me explaining that when I speak about that in the field.
Okay.
Then the next question is, what is the first thing you should do if you suspect your horse has an abscess? Should you call your farrier, give meds, call your vet? And then she would also like to know how often should your horses have their feet done? 6 weeks, more or less?
Darren, I'll let you do that one if you want to.
Sure. Thank you, Mr. Barker. No worries. As far as the interval, the farrier interval, the standard that is spoken about is 6 weeks. That's the normal farrier interval, and that would be for a horse is often thought about on a barefoot and or shod horse. However, some of your horses, depending on their nature of work and their requirements, some of them are done on a regular 4-week schedule and some on a 5. So it would be safe to say between 4 to 6 week interval for farrier care. And then the tell me the second part again, please, Mr. Corbin.
Let's see. How often? So you just answered the how often you do the feet. Who should you call? What's the first action that you should take when you have an abscess?
Well, certainly the first thing, if that horse is presenting like we see horses often present, it'll be a very acute presentation of lameness. It will often is severe in nature, and so I would say that the phone call would go if you the phone call first would be to your veterinarian because you have a very lame and painful horse. I would call your veterinarian first, and then if somehow you feel like that it is a foot-related problem, or you could diagnose or excuse me, if you could determine that it's in the foot or feel as though it's in the foot, then a phone call to your farrier as well, and hopefully, they could one or both could get there very quickly to take a look at your horse.
All right, thank you, Darren. This actually isn't a question, but a bit of a testimonial from Darlene Berry. She says that she's used Farrier's formula, double strength, and it rocks. I took pictures of my horse's feet before and after, and you can actually see where the new hoof was growing out. I love this product. Thank you, Darlene, and we would love to see those pictures. If you wouldn't mind, you can send those to cservice@lifedatalabs.com, and we'd love to to see them and possibly feature you on our testimonial page. This next question is from Ann Morgan. What is a hospital plate?
Darren?
Mr. Barker, would you like me to take that, Mr. Barker?
Yes, sir, go right ahead.
Okay. To the person who asked that question, a hospital plate is essentially a protective plate that'll be fabricated to go on the bottom of the horseshoe to as to not allow anything from the ground, anything from bedding or pressure or anything to contact the horse's foot. The horse's actually has a shoe. The shoe's put on, and on the shoe there's actually holes that are drilled and tapped, and there's little small bolts, we'll call them, or they are bolts. And so essentially there's a plate that goes on the bottom of the horseshoe, and then the bolts are screwed into the horseshoe, and that keeps any of the treatment packing that the veterinarian has instructed to go in the bottom of the foot to take care of the wound in there, and then the plate goes on the bottom so nothing can get in there to cause the horse any difficulty at all. And that hospital plate will normally stay on in the early stages of recovery until they feel like the tissue in the foot has healed itself to the point that it can maintain anything that it may come in contact with, either stall bedding, dirt, mud, grass, whatever the horse may transverse across.
Okay. Next question is again from Ann Morgan. If you seal hoof cracks and or old nail holes, doesn't that trap the bacteria and create an anaerobic environment so the bacteria like thrush, etc., can grow and thrive?
If you use the hoof clay is an antimicrobial in itself. So, and it actually is made from clay, which is breathable. So it's not going to seal the needed oxygen to the foot itself. The clay is also going to hold the active ingredients where it needs to be. That's going to eliminate any bacteria that would be present.
Okay, and then she would also like to know, what is tamed iodine and how do you apply the farrier's finish?
Tamed iodine is just a very mild form of iodine. It's less likely to have a burn from this version of iodine versus some of the stronger iodines that are available there. Farrier's finish will be applied to the entire foot, the entire sole, and the hoof wall itself. It can be brushed on, it can be sponged on, whatever your preference is going to be, but basically get it on the entire foot. Under normal conditions, where the environment's not a problem and we don't have a problem with bacteria or fungi, 1 to 2 times a week on all feet as a preventative measure works great. If we are under some severe conditions as far as excess moisture or a lack of it, or if we got a thrush problem or a bacterial problem going on, then let's use it 3 to 4 or 5 times a week until we get beyond that situation.
Okay. I think it's also good to point out that the finish and clay can actually be used together. Is that correct,
The
Mike?
clay can be used first, yes, Corbin, and we're going to use that in our specific problem spots, and then we can come back with the liquid over the top of all of that, the entire foot then, yes.
Okay. And then while we're talking about the topicals, I think this question is a good one to go ahead and bring up. But when we discussed the caustic chemicals and not to use them, can you give us an example of some that we may want to avoid?
Well, a lot of your horse owners are familiar with chlorine, Clorox, or whatever, and chlorine will actually, or Clorox will actually burn. It will kill hoof tissue. That's a prime example that a lot of horse owners will want to use.
Okay. And then this one right here came from Michael Moran. Is the farrier's finish identical to the older right step?
Part of it is. In fact, years ago, we had 2 different products. One was Right Step, and the other one was our Hoof Disinfect. And we had several individuals that would take both of those products and actually mix them together. And by doing that with one application, they were protecting from the environment, which the right step would do, and then the disinfect would take care of your bacterial issues. So the Farrier's Finish today is a combination of the right step and the disinfect. So with one application, we're taking care of the environment as far as wet, dry, and then the bacterial issue.
All right. Okay, so this one is from Denise Schleifer. I have a gelding that had an abscess and a part of the outside of the hoof came off. It's healthy otherwise. Will the hoof clay help support the part that is gone? He normally doesn't have a problem.
It will help protect that from an invasion of bacteria, yes. And feeding this horse Farrier's formula will help regenerate and regrow that foot out over a period of time.
This is from Nancy Corbett. If a horse is barefoot and has had laminitis and has abscessed, is it recommended when riding in a sand ring to wear protective boots so sand does not get into any openings?
Darren, you want to take that one?
Yes, sir. Be happy to. Laminitis in its own right does have a deformation effect to the hoof capsule, depending on the degree in which the laminitis, what degree of laminitis the horse was subjected to. So I would certainly say that any type of protection to help that horse would certainly be good, in the sense that we're talking solely on the principle of the presumption that there's compromised lamina, like we'll see in horses that are that have had laminitis, or maybe they're exposed to it or have had it on a couple different occasions. They'll have that, we'll call it a dorsal wall scar that develops in there where that stretched lamina is, and essentially is a weakened area, which would be an opportunistic position for the horse to take in bacteria. So and or debris as well. So it would be something, if that exists, then certainly that would be a qualifying factor for protection. Absolutely.
Okay. Thank you, Darren. This is from James Phipps. Can the clay be mixed well enough with copper sulfate or zinc sulfate? Is it even necessary?
It's not necessary to do that. In fact, the clay by itself is going to be effective against any type of bacteria or fungi.
Okay. This is from Lauren Cowhey. Will any meds help with an abscess?
That would be totally up to the situation itself. It would also be up to the veterinarian that would be attending the horse. Under most conditions, meds are not given.
Okay, this is from Ron Vogel. Thank you for the webinar. You're welcome, Ron. What products would you recommend for chronic laminitis? Morgan that will abscess while wearing soft ride boots. Metabolically, this horse is under a veterinarian care and farrier care.
We have a couple of products. In fact, Farrier's formula is going to be your first line of defense, and that needs to be fed on a daily basis. The newest product that we have just released is our laminitis formula. And the laminitis formula is fed in conjunction with Farrier's formula. So take a look at that, and if you need any additional information on that, we would be glad to get that to you.
Okay. Let's see. And then what are the first steps to do for a horse that's having chronic abscesses?
The first step, we need to take a look at nutrition. And then we need to take a look at in the environment. Nutrition is highly important, and I can't stress that enough, in getting a good, sound, solid foot underneath the horse, a healthy foot. And if we have a healthy, sound foot, this should eliminate this excess abscessing. And then when we take a look at the environment, we need to be mindful of that as far as the wet conditions and then the bacteria that causes all these problems.
All right, great, Mike. Darren, this question is for you, I believe. This is from Susan Dunstan. If a barefoot horse has experienced an abscess which came through the coronary band, should the horse be shod to help with recovery? The horse is currently on Farrier's Formula Double Strength, and she's been on it. The horse has been on it for about 45 days.
Well, it's great to hear, Corbin, that the horse is on double strength Farrier's Formula to aid in a speedy and solid recovery as far as the hoof wall is concerned, and that's going to be her best asset essentially, because you know if it is in fact as the gravel has come out the top or the wall infection has shown itself at the coronary band, there is going to be that damage, and the horse owner will see that line develop in the hoof capsule as it starts to come down. You know, that would be a conversation that if that horse was under my care, it would be a shoeing or a farrier visit to farrier visit conversation. And it would depend on how the horse is doing. If for example, if I saw that I felt that hoof needed some sort of stabilization and protection, then I would feel very comfortable putting a shoe on. If the horse is continuing to do his job well and we're not seeing any problems in that regard, then there are a few little techniques, trimming techniques that I would employ if in fact the owner was the horse is doing well and the owner would like to keep the horse barefoot, then we would work hard to try to do that for the owner. So I think it would be a visit by visit conversation. I don't know that there's a one particular answer that the horse would have to be shod because it in fact had an abscess.
All right, thank you, Darren. Let's see, this one's from David White. What would cause a horse's frog to be fibrous?
Well, there's many things that can cause that itself. Of course, that frog is going to naturally shed at some point in time as well. And I don't know if the horse has another problem as far as thin soles or whatever. It could be attributed to bacteria, excess moisture. There's many things that can cause that problem. So.
Awesome. Okay, another little testimonial from Lauren Cowhey. Love your products. I use many of them. Thank you for making such great products that work. Thank you, Lauren. Okay, we are getting on to our last question here. And so after this last one, we'll begin to end the webinar. So if you do have a question, please submit it as soon as you can. That way we make sure we get to it. Okay, and this last one, will Farrier's Formula Double Strength help condition the hoofs too? Not exactly what she means by that.
I don't know exactly what you're asking per se, but it's going to help the hoof in improving hoof quality, yes. And as we have stated over and over, if you've got a good, healthy, sound foot, then that foot's going to be more resilient against a bacterial or a fungal infection. Now, Farrier's Finish, the topical, is going to help, I'm assuming if I interpret your question right, condition the outside of the foot as to either shedding that excess moisture or retaining the needed moisture.
Great, thank you. Okay, so that is the end of our webinar. Let's see. We will have this webinar has been recorded. So later this week, we will post it onto our YouTube channel for any of you to watch. We'll be posting it onto our Facebook page. So if you're not following us on Facebook, you can just look up Life Data Labs Inc. and you can follow us there. Again, we'll post that video to Facebook later this week. We will post it onto YouTube. You can follow us on Instagram. But I want to thank everybody who attended today. Thank you, Darren, for helping us out, for coming on here. It's always very enjoyable to have you with us and to discuss this with you. And again, if you have any topics that you would like to hear from us discuss, feel free to message us on Facebook. Feel free to email us and put in those requests because we'd love to hear them. And again, if you have any questions, you can visit us at www.lifedatalabs.com. You can find more information on the products that you heard about today. You can visit our blog where we have a lot of additional information. And we also have testimonials on each one of our products that you can look at and review, a lot of before and after pictures and so on. But again, thank you everybody for joining us today, and we hope to see you guys on the next webinar.